Assalamu alaikum students. So today we will discuss the MCQs related to respiratory system. Which of the following structures serves as the primary site of gas exchange in lungs? So the primary site of the gas exchange in lungs are the alveoli. So these are the alveoli. Which type of epithelium lines most of the conducting portion of the respiratory tract? So the most common epithelium in the respiratory tract, most frequent epithelium is the pseudostratified ciliated columnar epithelium. The respiratory membrane is primarily composed of two layers of pseudostratified epithelium, capillary endothelium and alveolar epithelium, smooth muscle and elastic fibers, cartilage and connective tissue. So it is the capillary endothelium and the alveolar epithelium. The trachea is supported by C-shaped ring of. So the cartilage in the trachea are of hyaline variety. So what is the function of the goblet cells in the respiratory epithelium? What is the function of the goblet cell in the respiratory epithelium? So the goblet cells, they are involved in gas exchange. They absorb oxygen. They secrete mucus, produce surfactant or phagocytosis of the pathogens. So the function of the goblet cell is to secrete mucus. Which part of the respiratory system contains both food and air passages, air pathways? So nasal cavity, larynx, trachea, pharynx, and bronchioles. So it is the pharynx through which the air and particles both pass. Which of the following cells in the alveoli secrete surfactant? So these are the type 1 or type 2 pneumocytes. I think this is type 2 pneumocytes. Just let me confirm it. Type 2. Okay, this is correct. Type 2 pneumocyte. The right lung has how many lobes? 1, 2, 3, 4, 5. So right lung have got 3 lobes. Which of the following best describes the changes in the epithelium from trachea to alveoli? So epithelial change from trachea to alveoli is stratified squamous, two simple cuboidal, two pseudostratified, simple squamous, two stratified squamous, two columnar. Okay, pseudostratified columnar, two simple cuboidal, two simple squamous. So in the upper part of the respiratory tract, the epithelium is pseudostratified columnar epithelium, and as we go down, it changes from pseudostratified to simple cuboidal and then simple squamous. Which structure divides the upper and lower respiratory tracts anatomically? So it is the larynx. Which structure contains smooth muscles but lacks cartilage? The trachea contains smooth muscles and cartilages. The bronchi contains secondary bronchi. The larynx also contains. So terminal bronchioles are the structures which contains smooth muscles but lack cartilage. Laryngeal inlet is bounded anteriorly by which structure? Laryngeal inlet. So this is the epiglottis. Which of the following is most likely to be lined by stratified squamous non-keratinized epithelium? Stratified squamous non-keratinized. It is the nasal cavity. Which of the following correctly matches a cell with its function in alveolar histology? Type 1 pneumocide surfactant production, type 2 pneumocide gas exchange, alveolar macrophage, phagocytosis of debris, goblet cell oxygen transport, ciliated cell diffusion of gases. So it is the alveolar macrophages that phagocytose the debris. Which statement about the right lung is correct? It is longer and narrower than the left lung. It contains a cardiac notch. It is divided into two lobes. It has a horizontal fissure. It receives air from the left main bronchus. So it is longer and narrower than the no. So it has the horizontal fissure. Trachealis muscle connects which part of the tracheal cartilage? It is the lateral borders, interior portion, medial ends of the rings, inferior border, posterior lamina. So posterior lamina is the which of the following explains why gas exchange is efficient in alveoli? Presence of ciliated pseudostratified epithelium, cartilage supports the alveolar wall, thick basement membrane, type 2 cells form tight junctions, minimal distance between air and blood. It is the minimal distance between the air and the blood. Which of the following accurately describes a feature of terminal bronchiole? The terminal bronchiole is lined by stratified squamous epithelium. No. It is surrounded by cartilage plates. No. It has no goblet cells. Participate directly in gas exchange. Contain alveolar pores. So this has got no goblet cells. Nasal concha function to produce mucus, warm and humidify inhaled air, initiate cough reflex, support vocal cord movement, direct air into sinuses. So it warm and humidify inhaled air. Which of the following lung structures is not part of the conducting zone? Conducting zone. So conducting pathway. Primary bronchus are the part, respiratory terminal bronchiole is the part, respiratory bronchiole is not the part of the conducting pathway, rather it is the respiratory pathway through which the exchange occurs. Conducting path zone means only conducting the air, no exchange is happening. Which muscle is primarily responsible for increasing thoracic cavity volume during quiet inspiration? So, okay, quiet inspiration, this is the diaphragm. The diaphragm is the main muscle of the inspiration. Which structure is shared by both digestive and respiratory systems? Nasopharynx, larynx, trachea, pharynx, bronchi. Again, same question. Respiratory epithelium primarily facilitates what? Active transport of gases, filtration of blood, trapping of particles and mucus movement, immune cell production, bone marrow regulation. So it traps the particles and mucus movement. Which of the following is true about bronchioles? They contain rings of cartilage lined by transitional epithelium. They contain rings of cartilage, bronchioles. lined by transitional epithelium, do not contain goblet cell beyond terminal bronchiole. Alveoli are present in terminal bronchioles. They are part of respiratory membrane. So bronchioles, they do not contain goblet cell. Which nerve controls the motor function of diaphragm? So it is the phrenic nerve. So I hope this is helpful for you.